swine flu scare has taken the whole world by storm, literally shaking everyone in their boots, and India has been no exception. The past 2 weeks has seen an unprecedented rise in the number of fever cases in India, and everything is being attributed to swine flu. There are certain misconceptions about the disease that I'd like to clear. The most important thing is that this is a flu like any other flu, and there is really no need to get scared of it. Probably by the time you realize that you've had swine flu, 99% cases are going to get. Probably by the time you realize that you have swine flu, more than 99% cases are already better and on their way to recovery. Unfortunately, it is only the 0.1 or the maybe 0.001% cases who reach the hospital due to delayed response or maybe not responding to routine medication, and where complications have set in, that swine flu gets diagnosed. And I believe that for every case of swine flu that gets diagnosed, there are probably at least 1 million who are already better and completely hale and hearty. So it is actually, there is too much of hype about this disease, which can be easily controlled with proper safety precautions. Just as in any epidemic, homeopathy has a huge role to play as a preventive system of medicine. Every time there's an epidemic, right from the time of Spanish flu in 1918 or the Asian flu in 56 or the Hong Kong flu in later on, and the swine flu scare again in 1976, homeopathy has played a vital role. We evolved a set of certain specific medicines which are useful in times of these epidemics, known as the genus epidemicus. Although we all know that homeopathy is a strictly individualist system of medicine, where each patient is evaluated as per his personality, and tailor-made or customized medicines are given to each individual. Yet in times of epidemics, it is the common symptom picture and the common clinical presentation that makes us devise a set of medicines which can be helped only during the specific epidemics. This year, in this epidemic that has been going on, that is the flu epidemic, we have devised about 3 or 4 medicines which have been very useful as preventive medicines. Some of them are oscillococcinum, variolinum, influenzinum, and pyrogenum. And given to various patients under various conditions, we have found that we can abort most cases of flu, especially in high-risk areas and contacts. We have found them extremely useful. They have either aborted the attack, or if the symptoms come, if the symptoms present, they are very mild and self-limiting. Even where in proven cases of fever or influenza, we have seen that certain medicines like bryonia, baptisia, gelsemium and arsenic album have been very useful in the current epidemic. Of all the around 400-500 cases of fever that I have seen in the past couple of weeks, almost all have recovered with homeopathic antivirals alone, and just a couple have had needed to take antibiotics, referred to allopathic specialists as and when the need arose. And most of them have recovered very well and without any after effects like weakness or tiredness or loss of energy. That is the biggest advantage of homeopathy, because it restores the equilibrium of the body without the aftermath.